Welcome. Thank you for joining us this evening for the Office of Early Childhood Vaccine Update. We're grateful for the partnership of our other state agencies. We have representatives tonight from the Office of the Governor, from the Department of Public Health, and the State Department of Education. My name is Rachel Leventhal-Weiner. I'm the OEC's Chief Research and Planning Officer. I will introduce our commissioner in just a moment, but before we get started, we wanted to recommend that anyone who needs access to live captioning and subtitling can do so by accessing the CC button in the bottom right-hand corner of your screen. There's live captioning available in 6 languages this evening, including Spanish. If you have any questions or problems, you may use the QA function to send us questions. We'll have ample time for questions and answers later in our program, and we thank you for your patience. We may not answer every question this evening, but we will do our best to put a question and answer document up on our website as soon as we can. Without further ado, thank you so much for joining us, and I'll introduce our Commissioner, Beth Bai.
Thank you so much, Rachel. Welcome, everybody. We have quite a collection here tonight. We have many people interested in the topic to give an update about vaccines since the governor's announcement on Monday that teachers and child care staff will be prioritized. So on the call, we have family child care providers, center providers, administrators, superintendents of schools were invited, health districts were invited. We're really grateful to be joined by the incredibly hardworking Department of Public Health team, the Office of the Governor, represented by Michelle Gilman is here, and the State Department of Education with John Frasnelli. We have been partnering since Sunday when this announcement came to us as we prepared for the public announcement Monday, and we continue to work with localities, with programs to answer their questions. And tonight is a chance for us to really have a conversation with you all about this, and your questions will help us to guide this whole process. Childcare is actually the first sort of sector of private employers that have been prioritized in this pandemic vaccine rollout that needs to be vaccinated outside of their own system. Hospitals obviously have been prioritized, and healthcare workers, but they had their own healthcare system with which to deliver the vaccine. So we're in uncharted territory, and I can promise you people are working around the clock to make this work as well as possible and to meet your need to get vaccinated. This is really exciting because we can see on the horizon that child care providers will be vaccinated in the near future. It doesn't mean there aren't challenges, but we're going to navigate those together. And with your feedback, we think we can do this. We can do this as well as possible. OEC is here to help with local health directors or superintendents that need to communicate. We sent a letter last night to them saying we're here ready to help you make those critical connections with child care programs in your community. For the communities that are setting up community vaccine clinics. So that's just sort of by way of introduction. I do want to go over who is eligible for the vaccine because I know there are a lot of questions about that. And in the chat, we will put the link to the website that lists who is eligible. So it's child care teachers, assistant teachers, paraprofessionals, administrative staff who have contact with parents and children, program support staff who have regular in-person contact with children or parents, transportation professionals. You may have food service professionals who are in contact with children, but basically your front-facing staff who are with children. Also, summer camps, some are open right now because they've been providing childcare. Those camps that are currently operating, they are considered childcare and their staff are eligible. Other camps have to be within 60 days of accepting children to sign up for their vaccine. But as soon as they get close to operating time, they are then considered childcare and will be in a prioritized group. Additionally, disability staff, birth to 3 providers who have to be in childcare programs or who are providing services in childcare programs to children are also eligible. They're considered childcare staff, staff working in childcare centers who are with children. The other question that's come up is how will people vaccinating me know that I'm in this priority group? We've worked to have those ID requirements be as simple as possible, but we still want to make sure that the people coming for vaccines are the ones, are actually childcare workers, are teachers. So you can bring a work badge with your school name on it. You can bring a pay stub. You can bring a business card. You can bring a copy of your childcare license with your name on it, because we know like family childcare providers don't have badges, but they are all licensed. So they have a license or, you know, some proof that you work in childcare. So hopefully that answers the eligibility, and the idea answer some questions. I'm not the public health expert, so we'll get to them soon. But first, I also want to introduce John Frasinelli. John and I have been on many calls over the course of the pandemic, but especially in the last week. John and Charlene and Desi, the team at SDE, have been meeting with superintendents, and they've just been doing a super job of communicating that the vaccines that are rolling out for teachers are also for childcare providers, just to help those communities that have the capacity to remember the childcare community. And they've had me on all of their calls. And I just think it's important for you to hear from John about what they've been doing to raise awareness here and communicate with the field. So John, do you want to say hi?
Sure, thank you, Commissioner, and thank you for inviting the department to be part of this. And as the Commissioner said, it's been all hands on deck for quite a long time now. And now as we roll into the next sort of phase of COVID, we will be working together on the vaccine. As the Commissioner mentioned, school staff are part of this phase as well. And the purposes for all of us to be on all of these calls together is to make sure that we're all coordinating together. So we are at the Department of Education are in constant contact with school superintendents and school nurses and school medical advisors about this, about the pandemic and about the vaccine rollout. And so I'm here to listen, to hear what your concerns are, and just know that we are communicating that with superintendents. We will have another call with superintendents this Friday, and then we also have a weekly call with local health directors and school superintendents. So there are many opportunities for us to make sure that we're all coordinating together to facilitate as quickly and as efficiently and effectively as possible that all of the folks in childcare and the education sector get vaccinated in real time. So thank you, Commissioner.
Oh, thank you, John. And I know I spoke with Fran Rabinowitz from the Superintendents Association today. They've really been great, and I know it's because SDE has been working with them throughout and communicating with them regularly. So we really are grateful for your partnership at the State Department of Education. Okay, next up is Michelle Gilman, who is the Deputy Commander of the whole incident for the state of Connecticut. She's not getting much sleep, but Michelle, I know the early childhood field is really grateful to Governor Lamont and to people like you who had to work out the math behind the scenes, who's having to work with hundreds of local health officials and work to make this happen on the ground. The operations are just huge, and you've been doing an incredible job throughout. And I'd love it if you could just give some context to the providers from the governor's point of view and Josh Jabal's point of view. Thank you so much.
Absolutely. Thank you so much, Commissioner. I very much appreciate the opportunity to speak tonight and really to hear the concerns and questions of this critical workforce. You have been dogged throughout this entire pandemic, caring for our children, and we are grateful for that, and keeping our economy humming, but more important, again, taking care of children throughout this pandemic, which is beyond a challenge than any of us had anticipated. So on behalf of the governor, thank you for all that you are doing day in, day out, in the evenings. We recognize that this is not a Monday through Friday 9 to 5 role, and that you are all committed to this effort. And so we hope that you're excited, like we are, about March 1st approaching us. We are thrilled that you are part of this rollout and recognizing the commitment and the service that you have provided on the front lines. So very shortly, you will hear from Lorianne Wagner and Krista Veneziano from the DPH team with some operational guidance in terms of how this rollout will work. I do want to also acknowledge our superintendents who may be on the line, other administrators from our schools, and also our public health directors who are working tirelessly on the ground and have been as well throughout this pandemic, whether it's operating testing, updating contact tracing logs, continuing their day-to-day work. And now, as we look to the horizon of hopefully being finished with this pandemic, now supporting the vaccine rollout for the state. So again, equally as grateful to all of the partners on this call to help us get through, again, the end of COVID-19. So our goal, the governor's goal, this team's goal is to ensure that every child care provider, every employee at a center, anyone who is tied to child care under the eligibility that the commissioner outlined has the opportunity to receive a shot in the arm by March 31st. So we are going to work diligently as a team on the ground to ensure that you have that opportunity to get that first shot by the end of March. It's a Herculean task. Our allocation of vaccine from the federal government is still not where we want it to be in order to provide that shot in the arm for everyone that would like one in our state. And that's, again, part of why we did this rollout for our educators and child care professionals, so that we can keep schools open and that we can also keep our child care centers open as well moving forward. And then again, recognizing the job that you are doing day in and day out. So we ask for your patience as there will not be enough supply on March 1st or March 5th. To get this task done. This will need to be done over the course of the month of March, but we pledge that it is our commitment to get you that shot in the arm if you would like it. And with that said, I do want to also acknowledge that certainly many of you or your employees or colleagues that you're working with may have questions about the vaccine. You may not be certain that you want to get that shot and you have questions about that. There are multiple resources, as you probably know, from the CDC, on the Connecticut DPH website, on your local health director's website, and other areas where we want to be sure that you have the answers you need to make the decision about getting the vaccine. First and foremost, reaching out to your medical provider if you have one. And if you don't, let us help you get the information you need to make the decision. We again recognize that you may have a lot of different questions, and again, getting that guidance from a medical professional, whether it's your doctor or another one at an urgent care center, and at one of our FQHCs, at a hospital. We want to give you the information you need for this decision, but please let us help you to get to that get that information as you need it. And again, it may be helpful as well where you are working in a larger center, Boys and Girls Club, or something along those lines, where you post information so that other employees can read and share that information accordingly. So without any further comment from me, I will pass on the line to Lorianne Wagner and Krista, who will go through some of the mechanics of how you can actually access vaccine come March 1st. We do have multiple front doors, as we refer to them as, for you to obtain vaccine. We are encouraging our local health directors to work with you and work with all of our school systems to provide closed clinics so that you can easily know when a clinic is coming up in your community. And also there are pharmacies, CVS and Walgreens across the state who will have vaccine as well. There are hospital clinics, mass vax clinics operating across the state where you'll be eligible to schedule come March 1st. But again, we're hoping that we can offer as many clinics as possible through our local health directors and then their partnered efforts with other entities throughout the state. So Lorianne, Krista, I will turn the floor over to you. Thanks so much.
Good evening, everyone, and thank you for having us here. I'm very excited for you and about the effort that we've put it together collaboratively to try to make this possible. But there's a lot of work still to be done, right? We're building the plane as we're flying it. And that just means that everything may not roll smoothly from your perspective, and at times ours, and it's not going to roll fast. Although I'd like to argue that we're saying we're going to get a shot in everybody's arm within a month, and that's pretty significant. That's moving pretty fast. It may not feel fast to you when you find that you might have to wait 2 weeks when you go in and try to schedule or you're getting your clinic set up. But before I go too far down that path, I want to introduce Krista Veneziano and invite her to share what are the immediate next steps when we start thinking about, okay, I just found out I'm eligible, now what? Now what do I do? What's the first step we take? Krista, why don't you share that with them?
Great. Hi, everybody. Thanks for having me back. I was here before and I had such a great time. When they asked me to come back, I said, oh, yes, of course. Absolutely. Very excited to be here. And I'm excited that I have this information to share with you. So what are our next steps? We want to make sure that you have your employee rosters all set, ready to go when it's time to provide them to somebody. Remember last time I was here, we talked about, is VAMS going away? Are we keeping it? What's happening? Now it's still here. It's still working full force, but some of our local health departments don't use VAMS. So if you upload your roster into VAMS, they won't see it. So we kind of need you to be a little patient, but then work with your local health departments to say, do you use VAMS? Shall I upload it into VAMS, or do you want me to give it to you in a different way? I'm not sure how they would take it, but they use different scheduling systems. So we just want to make sure you're ready to go, and when they want it, you're like, here you go, boom, right here. So there's no delay, so they can get you into one of their closed pods or their closed clinics. So also, we want you to know who your local health departments are and know who you need to reach out to. I can provide a link where if you're not sure who your health department is, you can go on our website, the Department of Public Health website, click on a link of what your town is, and it will tell you who your health department is or your health district. So we want to make sure you know who to contact. So I'll make sure to put that in the chat for you or provide it to OEC. You probably already know who your local health department is, but I'm thinking maybe some of the family health, family child care facilities may not know since they don't inspect you. And I think that was I think that's what I wanted to review, unless I'm missing something.
No, that's great. And I can build on some of that, Krista. Why don't I do that? So Great. One of the things that I would say is I think that if you already have a relationship with your local health department, maybe you've already talked to them, that's great. But if you haven't, or if you've never reached out to them before, we have asked the local health departments to reach out to you. So what I'm going to suggest, because they're all going to be working studiously to try to pull their clinics together, is to give them a moment. So let them be the ones to reach out to all of you. And if you don't hear from them and it's next week and you're like, hey, how come I haven't heard about my closed pod or my special clinic that was created potentially just for you, what you're going to want to do is then you can reach out to that local health department. But give them a minute this week to try to pull this together and reach out to you. But the other thing I want you to know is some of you may just be this lone island. You feel like you're very alone and you might not have somebody reach out to and you kind of wonder, where do you fit? Well, it doesn't mean that you don't get vaccine. You do get vaccinated. You're eligible, so therefore you're going to get vaccinated this month. That's our commitment. Not this month, it's still February. Next month, in March. All right, between that 1st and that 31st. It's a nice long month. But what we're going to do is we're going to suggest to you that you're going to work on those rosters, just like Krista said. And on Monday, we will invite people to upload them. If you have not received any word that you should be doing it differently, you will certainly be permitted to upload your rosters for any of the employees within your childcare organization on Monday, March 1st. What that will do, it will allow the employees of your organization to register in VAMS. but VAMS only has this much appointment inventory in it. It's got a portion of our appointment inventory across the state. You heard Michelle talk a little bit about the many front doors. So we have the front door through VAMS, and that certainly offers some options. And it's also a really good way for some of our vaccine providers to offer that closed pod, that closed clinic that would just be for a specific group like educators or childcare providers. But we also have other ways to do that. And what you'd be able to do is you could, if you have access to internet, which if you're on this, then can you do, although some of you may have called in, you may be on phones, but if you have access to internet and you're able to get in there, you can go onto the ct.gov COVID-19 portal and you'll just say vaccine and you can pull up, it'll say, hey, I'm eligible, I want to schedule. If you click that, it pulls up a lot of options for you. And on that page of options, it'll say, hey, you can look here where a bunch of folks identify opportunity or have appointments available, and that's VAMS. And it'll invite you to register. If you've already uploaded into VAMS, don't have to worry about doing it again. It'll give you a special link. You can also look at the pharmacies, and you could go to the pharmacies and you go to CVS and Walgreens and Walmart, and it gives you links to those sites where you could see if they have availability. This feels really inefficient though, doesn't it? So what you might want to do if you're looking for an appointment on your own is you will look at the 211 map. Now I want to just giving you an inside scoop because this is not out there. The inside scoop is I think we're going to be improving that site greatly. So if you see that map and it feels a little clunky and you're not really sure, there's going to be some improvements made to that. So bear with us as we improve upon that experience, but it's still functional. So you can go to that map, you'll put your zip code in, it'll pull up the different sites that are available, and you could see how do they register for appointments. So as you can hear me say, there are lots of different options. You heard Michelle say that there's lots of front doors. I'm telling you there are lots of different ways to book a vaccine. The first thing we're going to suggest though is that you be patient. And the reason why we say that is we are making every effort to give you an opportunity to have an invitation to something that's created just for you. And that means people are thinking about you're working Monday through Friday during the day because you got little ones that you're watching. And if you've got little ones that you're watching every day, how do you get your vaccine? So there's going to be some creative, hopefully, options out there specifically with this group in mind. That's the intent of creating those closed pods. So bear with us while that is developed. And if you can be patient, you'll get it perhaps closer to home at a better time and not have to compete for a slot because it'll be created with you all in mind. If that's just not turning into an option or you're directed otherwise by your local health department or your school partner, then know that there are other ways to do this. One of the final ways that I have not talked a lot about, because anybody who's able to use the internet, I'm going to encourage you to do that. But we do have what's called the Vaccination Appointment Assistance Line. And it is staffed by people who are able to go in and book some appointments, but their appointment inventory doesn't cover all of the appointment inventory. All those other front doors that I mentioned are accessible through those front doors. They're not all accessible through the VAL. So keep that in mind when you say, oh, I'll just pick up the phone. You're only accessing some of the appointment inventory. So you may want to go look online first. I think I might be overemphasizing some things, but I just want to make sure that they're clear. And I want to make sure you all understand that we will get you vaccinated. You need to be patient, but I know you can because you all work with children. Patience is necessary for working with those little ones. And you need to know that we're here to help, and we're not going to leave you out there wondering what to do. There are different help buttons on a lot of these web pages, and we will get back to you. I think that's it.
Yeah, that's great. Lorianne, thank you so much. We really appreciate that. Just one thing I'm going to ask you to reiterate. I know you have reiterated it, but our concern is, I guess I have a concern that people really take you up on being patient, especially like during this first week, because people are going to great lengths to set up closed clinics just for teachers and childcare. People have been on the phone morning, noon, night since Sunday to try to arrange these, and it will be more efficient for you, and it will relieve pressure on the other system that's taking care of others. So both, you know, childcare providers are used to disorder too. Like as a toddler teacher, I can tell you there's a lot of disorder, but I think it's important to stress that these are being set up, and in places where they're not, I know that Michelle has been in conversations with Hartford Hospital, with the healthcare provider, so that in places where local health may not be able to set something up, there are other plans in place, and you all have surveyed local health. And so you're getting a sense of what the capacity of different local health departments are, and you're planning around that. So I do think it is important to give it till, you know, at least mid next week when we can provide you with an update. And I promise that OEC staff are going to be working to communicate with you all as well as this goes. And we have the capacity to make phone calls outbound from United Way by town, etc. So we're going to be using all of our resources to communicate as well. So this is really great news about the vaccines, but there's still patience required. But the idea that a week ago, the idea that every childcare provider in Connecticut would be vaccinated by the end of March was just not even in the realm of people's possibilities. So it's great news. And I so appreciate, on behalf of the childcare providers, all the work that you all at DPH and the Office of the Governor have been doing to realize this really complicated, challenging thing. I said to Deidre Gifford, I'll stop after this, who would have thought a year ago that the state of Connecticut would be setting up vaccines for every single citizen? Like, it's just a huge undertaking, because even as you're doing this, I know you're thinking about 45 to 55-year-olds, and when are those doses coming, and where do they go? Okay, now we're going to take some time for your questions that will help guide our communications with you. Rachel, I'm going to turn it back to you, or unless someone else is going to be asking the questions of the panelists.
I'm going to leave this visual up and I'll ask questions. Folks on the panel can chime in as we go. Since we were just talking about the deadlines, we do have a question about whether folks can register before March 1st, knowing that they cannot book appointments until March 1st.
We ask that you don't even attempt to schedule before March 1st.
So they should not upload into VAMS as well.
They will not be able to upload into VAMS. If we've already given them access to VAMS as an employer coordinator, we are asking that they not upload any of your roster. If you're asking to be uploaded, just know that we're not ignoring you. We are holding you in the queue, and you will not be uploaded until Monday.
Okay. There are some VAMS specific questions, so I'll go through some of those now. And
Okay.
Lorianne, I'm going to add your video so folks can see you. So is there a specific template that the roster should be in for uploading? And where should they find that template?
Yeah, there is a specific template, and I need to get that out to somebody. Who might I send that to, Commissioner? Oh, I'm sorry. I asked you a question.
You can send that to us, Lori Wagner,
Right
or
over.
Is there a way to post that somewhere, or no, that has to be emailed out?
No, it probably could be posted, but I need to get it from my SMA, my subject matter expert. So
Yep.
I need to get that template from them.
Great.
Okay, thank you. And we will make that available
Absolutely.
to those who need it, happily.
Lorianne, you did such an excellent job of detailing all of the different options that providers have for accessing their vaccination. There's a question which I'm sure is reflected in many people's minds. How should they decide which option to pursue? VAMS, a local clinic, a private healthcare provider? What's your best recommendation today?
Oh, I'm going to echo the commissioner. And I'm going to say, if somebody tells me they're building something for me, I am going to wait for that to be built, because it's going to meet my needs where I am at the time that I am likely going to need it. So I am going to wait for that special clinic that is being stood up for educators and childcare providers. Now, if I am told or I learn when it is, and unfortunately I have a conflict, then I probably would go to the 211 map first and find a space that looks like it has it close in an area that I'd be comfortable driving to or going to or have transportation to, and then I would look for availability there. You can go through any of the front doors if the closed, we keep calling them closed pods, but the special clinics that are being stood up for the educators of our state, the educators and childcare providers. So that's what I would recommend.
There are several questions about if folks have received an email from their town asking them for the number of staff that they have. Is that because that's an indication that their health department is likely setting up a clinic?
Krista?
Yes, I believe so. Absolutely. So they want to know how many people you have employed there. They're trying to figure out how many doses they need so then they can order it. So yes, definitely give that to them.
Okay. And there are several questions around vaccine appointment availability after 5 p.m. or on weekends. Many of our family childcare providers are working long hours out of their homes. So an after hours opportunity is really most beneficial to them.
So we know that the clinics that are being stood up, I said this earlier, I think, the ones that are being developed specifically for educators and childcare providers, I can confidently tell you they are exploring weekend coverage. So again, what we are building for you is intended to suit you.
Fantastic. So there are some questions around whether receiving the vaccine will impact quarantining procedures that have been established within provider settings. And that might be a question for our agency.
Yeah, I'm not sure. I'm not confident in any answer that I would give right now. We can find out though.
Well, I do know I'm not giving you definitive knowledge. I don't know if John has anything to add here, because I know the governor kept referring to teachers not needing to quarantine in his press conference after they've had both doses, because that's been a big problem in the public schools. But John, did you get any specific guidance on that?
There is some specific guidance, and I will say, and I won't share it here because I know this is very specific to the folks at public health, but I will say there are some circumstances, and it has to do with whether you develop symptoms at certain times following the vaccine, within certain windows of time following the vaccine, that you would have to quarantine. We have a link that we can share with folks to provide that guidance, and I can provide that so that can be sent out to all of you all.
Yeah, and I would be very comfortable bringing this back to Dr. Lynn Sosa. She's the one who provides us with all of our guidance around quarantining. And I think that we want to be very explicit with our child care providers. So I can certainly get that information for you.
That would be great. And then that could be a good Q&A to put up on the vaccine website for childcare and providers and teachers. I'm assuming they're going to be very similar guidance. But it does impact quarantine. We just want to be sure we get you the exact language that you need so that people are as safe as possible.
So the next question we have is again related to staff vaccination sequencing. So what recommendations are being offered around whether staff should receive their vaccinations on the same day because of the potential side effects? Or should they stagger?
So we are suggesting that you get vaccinated, that if you have a large staff, that you may not want all of the staff to be vaccinated, the second appointment, most notably, because if we're seeing any kind of reaction, we're really seeing not feeling great after the second dose. So at the second dose clinic, if we were to divvy the staff up, it might be a good choice. Or if you're having a Saturday clinic, you're probably fine for Monday. That's what I'm hearing from our epidemiologists, right? So if you had a Saturday clinic or you had a Friday afternoon clinic, right, or evening, you're probably fine to not worry about everybody having to go to work on Monday. It's just if you had a Sunday and then a Monday, you wouldn't want to necessarily have everyone go at the same time.
Okay. One important question before we move on to ask some more about eligibility and next steps. Is receiving the vaccine mandatory What happens if a person who works in a center or family provider does not want to get the vaccine?
The governor has been really clear that he is not mandating the vaccine for anyone. I know that there has been some guidance. I don't know, John, what you're telling schools. I know our attorney, Mike Curley's on the line. I know he's looked into this. And maybe DPH is offering guidance on this as well. But I know the schools have been talking about this. Do you have any guidance, John, from SDE's point of view on the being mandatory, or if schools are allowed to mandate it?
Again, I would leave that up to both. I know our office has talked about it. We've talked with superintendents about it, and I would encourage superintendents who are on this call to follow up with their legal office around mandating vaccines.
Yeah, and I know
our
Early Childhood Alliance had a call with an attorney. So at this point, the state is not mandating it. And in terms of your own decision as a program, I think what John's saying is good advice. You should contact your attorney. And if we are able to offer global advice on this, we will. I know there have been some workshops about it, but Mike Curley, is there anything else you want to add?
No, I would agree with that, programs should seek their own legal advice, and there's no mandate by the state or the Office of Early Childhood.
Okay, thanks, Mike. Thanks, John.
So regarding proof of eligibility, if we could just describe again some of the ways that we can prove eligibility at either clinics or in person, that would be really helpful. What folks need specifically, and I think it's important to reiterate that while we're saying all this aloud, we'll have this all reflected on our own website, which we'll put a link to in the chat feature as well, so folks know where to look.
Sure. The items that I covered were work badges, pay stubs, business card, bring your child care license. The other thing that could happen is a center could write a letter on letterhead that this person works at a child care center in this capacity and is eligible. Any kind of, I was on the municipal call, and the way, and Michelle, you can chime in if this isn't your understanding, but on the call with municipal leaders tonight, what they said was some identification. They will be checking for child care and educators, but just some way to show. Michelle, is there anything to add that you have to add?
No, I think you've covered it, Commissioner. It is really an attempt to ensure that you as child care providers and professionals, along with our educators and other school personnel, are the ones indeed receiving the vaccine appropriately at these clinics. And that, especially at the closed clinics, there may be rosters in place, and our local health directors, other providers may not ask you for that ID, but we want you to ensure that you have it in case you're asked for it. And of course, you're eligible. And they may ask you if you forget an ID to, they're going to ask you to attest regardless that you're eligible. And that is under DPH procedures. It is subject to penalty of law. We don't want that to be a barrier that you anticipate when getting your vaccine. We want to get you the vaccine if you want it. And so if you forget an ID, that shouldn't be a barrier to you getting it. But it's really a mechanism to ensure that those who are eligible are indeed receiving it. And so as we move towards this age-based system as well, you may see our providers asking your family and friends and others for an ID verifying their age or their date of birth, something that proves that they are indeed the age that they say they are. And again, that's really an effort where unfortunately in some circumstances we do have people trying to jump the line. And we want to ensure that we have the vaccine for you, for our school personnel, and for the 55 and up category that's now eligible effective March 1st.
Rachel,
Thanks,
could I jump in for just a second?
Absolutely, Lori.
So the reason why I want to jump in is I want to offer you some information. I just got an update from one of our epidemiologist friends back at DPH, and I can tell you that CDC's public health recommendations for vaccinated persons now allows fully vaccinated individuals who are not working in healthcare settings to waive quarantine after an exposure to someone suspected or confirmed COVID-19. So where you might have previously been told that you needed to quarantine, you will not need to. That is after 2 weeks after you're fully vaccinated. So if you're doing a 2-dose vaccine, it's 2 weeks after your second dose, and that's for asymptomatic. If you're actively symptomatic, they would still say you don't deliver care, right? And you quarantine and you stay away from others. But if you are asymptomatic and you're 2 weeks post your second dose, you're fully vaccinated, then you do not, your quarantine waiver, you have a quarantine waiver. That's one of our primary reasons why we want to make sure, we want to keep you all safe, and we also want you to be able to consistently deliver services.
Okay. Thank you, Lorianne. So we have some questions around employees under the age of 18 who might be working in a childcare facility. Are they eligible for the vaccine?
I would put that up to Lorianne and Krista, because I know that there are clinical trials now going on with that age, and I'm not sure where 18 lands.
I think it's approved for 16 and up, if I remember correctly. And Lorianne's nodding her head, so good. I'm glad I remembered correctly. So anybody younger than that, we would tell you no, they should not get the vaccine.
Great, thank you. We have more than one question around the timing of the doses. So will everyone who receives the first dose in the month of March be guaranteed the second dose? And I assume these questions are being asked because as we get into later in the month, the priority, will go into April, for instance. And so the timing may not quite work out. So is everyone guaranteed that second dose?
Yes, so when you received your first dose, wherever you received it, they automatically get a second dose to go with the first dose when the time comes for the second dose. So there's a difference in timing for Pfizer and Moderna right now. So one is 21 days, one is 28 days, something like that. So depending on when you get your first dose, that clinic will receive their second dose 3 weeks, 4 weeks after the fact.
Great. Thank you. We have a question about whether you should register for a clinic in your work location versus your home location. So can staff receive the vaccination if they don't live in their town where they work? Can they receive it in their work health district?
Yes, I believe if your daycare facility or childcare facility, sorry, is working with the local health department where the facility is, that is the health department that will have your roster or your name. That's why I'm saying make sure everybody's on the roster. So then they will know, okay, Krista works at this daycare in my town. She's coming in on such and such a date at such and such time. So they'll know who you are. And then you bring your ID, you can show them.
Great, thank you. If we could describe again eligibility related to volunteers, substitutes, and family members in family childcare homes, as family members are sometimes backup staff, and their eligibility for the vaccine at this time.
I can answer. I think I can answer that. And Mike, chime in if I don't get this right. In terms of substitutes, they have to be a substitute on your list and have direct contact with children. Mike, is that what you were going to say?
Yeah, that's basically what I was going to say, that's what we're looking at, caring for the children. So family child care household members are not eligible as they're not the child care providers. But substitutes and assistants are eligible. I saw that question come up. And then one other question that I did want to confirm is that the contact information that the Office of Early Childhood shared with local health departments did include family child care homes. So they have that information to reach out to family child care homes as well as child care centers.
Right, and Mike, I'm glad you said that, because just so people know, on the municipal call today, we specifically said to local health departments that family child care is included in the vaccination. You know, a lot of times when you hear child care, a superintendent might think of a child care center. And so we're trying to be really explicit with the communities about what we mean by child care and really stressing the family child care part. And again, stressing that we know there are many very small businesses, but that OEC is willing to help make those connections as we can. So, okay, Rachel, what else you got?
Great. So there are some questions about the timeline for camp staff, for licensed youth camps, if they're able to obtain the first and second doses, to have the effectiveness in advance of the start of camp, and also some questions around if these clinics are run in the month of March, what about camps that will open in late May or early June?
Thank you for that question. We are not in a position to offer camps that aren't open vaccines in this round. When they become, much like right now, if a hospital hires a nurse right now, they get prioritized as a healthcare worker. As soon as camps get within 60 days of opening, their staff become considered child care workers. So I guess the public health question to Lorianne and Krista, and you can feel free to answer now or go back and discuss it with Dr. Carter, if 60 days is enough of a window to get both vaccines and have them be effective in time for camp.
We're going to need to go back and ask that. I don't want to answer that without consulting.
Well, to the camps, we will get back to you. And certainly the intent of the 60 days is to create a timeline that will allow you to have your camp staff vaccinated in time for camp to begin. Camp is childcare. If ever there was a summer kids needed to be outside at camps, it's this summer. And so we are going to work with you on that, and we will wait to hear back from DPH and provide any needed updates to that policy to match up with the public health guidance.
Great. Thank you to you both. We have a question, and Mike Curley, you might be the right one to answer this question. For providers who want to use their roster from our background checks information system with the Office of Early Childhood, how should they go about doing that?
So there is a feature in our background check information system that allows programs to download the roster from the background check system in the format that is appropriate for VAMs. So it includes the first name, last name, and email address of each staff member. And we have some instructions on how to make sure your roster is ready. And if anyone does need that, you can send me an email at michael.curley, C-U-R-L-E-Y, @ct.gov. We can provide that, and that has been posted on our website, and we'll get that posted on our website again for anyone that's looking for it.
Thanks, Mike. Got that question in our first virtual town hall as well, so there's probably a frequently asked questions document that includes the instructions. So this is a question, I think for Lorianne and Krista. Is there a way to know which vaccine is offered at all of the various locations?
So we're working to improve upon that. I'll be honest with you, we rely on our providers to update some of our websites, and collecting from that many different entities and the way we're moving our vaccine through is somewhat challenging, but we're working to improve that. That's one of the upgrades that we're looking to do to that front door that I talked about. But the one thing that I will say is where you book your first vaccine, we're asking providers to manage the booking of the second vaccine to ensure that first and second vaccine are appropriate, right? Because they need to be the same. Mm-hmm. As far as shopping around for a vaccine, just to put out there, we really suggest that you take the vaccines that are available, because there's no reason for us right now to believe that one is better than another. So the vaccines that are there, we would encourage you to just have that vaccine taken, but we are working to get that information out. at the start.
Okay, Lorianne, can I follow up, Rachel, quickly with that? Is it possible, you know, maybe not this week, but maybe within the next week and a half, to do a conversation with providers about the concerns about the vaccine and some of their worries or their staff worries? We were asked if we could do like a sort of a conversation, and I know there's some great materials that have been developed. That webinar could be a chance to just highlight the materials that are out there that programs can share with their staff, answer some of their questions. You know, I think directors feel a great responsibility for their staff, and some of them have concerns, and you know, so is that something that DPH, even if there was something prepared, you know, whatever, but that's been a request.
I definitely think that, yeah, I was looking at you, Michelle, you're looking back at me. So, yeah, I think that that's something that we definitely want to offer. If there's concern, if we need to answer some questions, there's been a lot of discussion about doing various town halls across the state to improve vaccine literacy and an understanding of what these vaccines are. There's also some really good information on the DPH website, and there's links to the CDC website with a lot of good information there. Now, some people may want to do more than the self-study. They may want to do a Q&A. So I can appreciate why you might want a webinar. And we can certainly explore that.
We can put some of that in the chat. Maybe Deb Fliss already has, but she's pretty quick on the uptake there. But if not, if someone from OEC team can put a link to those resources in, they're probably already in there. But.
And just to reiterate, Commissioner, that we, after our first vaccine announcement, or we did put together frequently asked questions, and we continue to keep our webpage updated. We updated it on Monday with as much information as we had, and continue to update it. So please just check, and we'll put the link to our webpage with the most recent vaccine information on in our chat feature as well. One final question, because I think there's some questions around safety, and I think that speaks to the vaccine hesitancy. Will we need to get the vaccine again later this year, or is this a vaccine like the flu vaccine? Do we know yet where it will have to be repeated?
I don't think we have that information. I think that I could go back to DPH and I would hear that same thing, that we don't know the answer to that question right now.
Okay, all right.
If I could also add to that, once you are vaccinated, it is still really important to wear your mask, keep social distancing, wash your hands, you know, and reinforce that with, you know, your employees and also with the kids in your programs, because there is still uncertainty about how long it will last. And because of the other strains, you know, what that could also mean for, you know, with regards to the vaccine. But I think we should all be really excited and continue to be excited as we see our rates of COVID go down in our nursing homes at tremendous rates and across the country as vaccine is rolling out. It just, again, continues to be the evidence that the vaccine is working, but we do need to stay vigilant to protect ourselves, but also to protect others that may have not been vaccinated yet or do not plan to get the vaccine.
Michelle, I'm really glad that you mentioned that, because I think that is a question we've been getting at OEC, and we've been saying the masks will continue to be required, but I guess I could ask Lorianne and Krista, that's your impression, correct? That for the near future, masks are still really important.
Yes, correct. Yes, absolutely.
Okay, awesome. One rumor that's out there that I have a text about is that Care for Kids providers are not eligible for the vaccine. That is not accurate. If you are a licensed provider or you are a license exempt provider, that's a municipal or school program, then you are eligible for vaccine. Care for Kids is not related to that. So I just wanted to, while we had a minute at the end here, Rachel, to put that out there. Are there any other burning questions out there, Rachel?
And we've grouped as many and answered all of the questions right now that we're able to answer. And I think it's important to reiterate patience that the information is changing, and that's all we have in terms of questions for tonight, Commissioner.
Great. Well, I want to just close out by saying this morning when I went out for my walk, there were way more birds chirping and I could smell spring. And I knew that I was going to be with you all tonight talking about getting childcare providers vaccines. So there is a lot of reason for hope out there. We have these incredible partners working to, as Lori said, build the plane as we fly it. In COVID, that's getting like the most well-worn metaphor out there. None of us have lived through a pandemic before, and the early childhood community has risen to the challenge and faced fears and worked so hard to support children and families. And with this, if you watch a press conference, you'll hear it as well. Governor Lamont is so grateful for your service, and he was really clear that childcare providers needed to be in this pool with teachers. And so we're just all going to have to be a little patient. I think take Lori Ann's advice and try to wait at first to hear from local health before making an appointment. And then know that if that doesn't happen, you have many options, and people like Michelle are planning huge vaccination clinics if we need them with Hartford Hospital and Yale and Greenwich Hospital and other big vaccine distributors. So there are many doors, but let's start with the local one, specifically built for your hours and days of the week to help you and help the whole system, because the system is sort of, everyone else is sort of we're moving along, and the governor has a new approach that we believe will lead to better equity and also to faster vaccination of folks. But you're getting special consideration, so let's try not to muck up the other system just to give it a chance. Give it 5 or 6 days to let it fall out, and let your local health directors, who are working so hard, they have been amazing, but give them some time to try to figure this out. Work with Michelle on what their vaccine distributions are and what they can manage, and then we can go out to the other options. But know that you have a lot of options in your back pocket, and let's start with the first option. So everybody have a good night. Grateful that you were willing to come on this evening, our childcare providers and our panelists. And I'm sure I'll see you all in the morning, those of you who are on the panel. But everybody have a great night. Bye-bye.
Thank you. Bye-bye.
Night.